رمضان طبيبي، معناك جليل بقلب جميل، يحوم النور بأنحائي، يحوم النور بأنحائي.
السلام عليكم ورحمة الله وبركاته. الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وأصحابه أجمعين. Welcome to the medical fiqh of fasting, and this is part 3 of a series on this topic. Alhamdulillah, today we will be discussing medication and fasting, and we will be discussing whether certain medications do break the fast and whether certain medications do not break the fast, and which medications can be taken while fasting. As we are aware that many patients are very keen on fasting, even though they suffer from chronic illnesses. And the only problem they do have is they need to take their medications regularly. It is recommended, however, that they do try and take medication outside the fasting times. This is after iftar and at the time of suhoor. However, we are also aware that there are many patients who require to take certain types of medication regularly during the fasting time period. It's also important that this discussion is had with your doctor with regards to adjusting your dose and also the timing of your medication. The first category of patients are those who have eye-related conditions. And there are many eye-related conditions, but the common ones are those of dry eyes. Those who suffer from dry eyes often require instilling drops into the eyes to keep the eyes moist during the day. And then there are those who have a condition called conjunctivitis that also require instilling drops into the eye. Then there are those who suffer from hypertension or high pressure in the eyes, those who have glaucoma of the eyes, and then there are those who have infections of the eye. And all these patients are those who want to continue fasting, but often ask the question whether they are able to use eye drops or eye-related medication while fasting. If we look at the anatomy of the eye, we can see that the eye is connected to the nose via the nasolacrimal duct. As you can see, there is a lacrimal sac and there is a nasolacrimal duct that drains into the nose. The tears are made in something called the lacrimal gland. Now, according to the fuqaha, the nasolacrimal duct that is shown on this diagram is not a qualified passage, and thus, even though you would instill medication into the eyes, it would then drain into the nose, and sometimes it may then drain to the back of the throat. This would not nullify the fast. The fuqaha feel that this communication does not qualify as a qualified passage, and secondly, the quantity that, if it were to make its way down, would be a very minute quantity and would not nullify the fast. Thus, the use of eye drops and various eye medication in the eye will not nullify the fast, and the person can continue fasting if they had to instill this medication into the eye. The second group of patients that we'll discuss today are those who have nose-related conditions. Again, these are common conditions of the nose that people suffer from and require medication often more regularly during the day. These are those who suffer from some sort of rhinitis. Allergic rhinitis is a common condition, sinusitis, and things like a postnasal drip. If we look at the anatomy of the nose, we can see that the nose communicates directly to the back of the throat. As we discussed previously, the throat forms part of the qualified cavity. Thus, if anything were to enter the nose and had a free flow to the throat, this would nullify the fast. However, many patients use either an ointment or a nasal spray that remains confined to the nose itself and does not make its way to the back into the throat. If so, then these forms of medication will not nullify the fast. However, if there is a risk of whatever is instilled into the nose reaching the throat, then this should be avoided and used outside the fasting times. The next group of patients that we wish to discuss are those who are asthmatic. It's important to note that the asthmatics are of various severity, and some are well controlled and are able to take the inhalers outside the fasting period. However, the inhalation of the asthma pump or the asthma inhaler or nebulization is a nullifier of the fast according to the majority of the fuqaha. This is because the inhaler is a vaporized form of the liquid or the medication, and this enters the throat, which is a qualified cavity. Therefore, an asthma inhaler will nullify the fast and should not be used during the fasting period. The next group of patients that often require medication while fasting are those who have ear-related conditions, often ear infections, and those who have wax impaction causing severe pain of the ear. If we look at the anatomy of the ear, we can see that the ear communicates with what we call the eustachian tube, which is in direct communication with the throat. However, there is a eardrum or the tympanic membrane that blocks off this communication between the ear and the throat. So whatever is instilled in the ear generally does not make its way into the throat and can be used and will not nullify the fast. However, if the patient is aware that his eardrum has been ruptured, then his fast will be nullified, because whatever medication enters the external auditory canal or the ear would make its way into the throat, and that is a nullifier of the fast. Inshallah, that will be the conditions we will discuss for today, and we will continue in part 4 with a few more scenarios. Assalamu alaikum wa rahmatullahi wa barakatuh.